Botox injections are the most common cosmetic procedure in the United States. If you have never gotten it done or you have gotten it done but you have questions, this video is for you. Stay tuned till the end of this video because I'm going to show you before and after photos of Botox results. My name is Dr. Swati Cannon and I am a cosmetic dermatologist out here in California. I have done thousands of Botox injections and I'm going to answer all of your burning questions in this video. I often hear a lot of common misconceptions and fears about Botox, so let's first understand what Botox actually means. What is Botox? Botox is a brand name and it is the original treatment that is comprised of botulinum toxin. And so Botox is short for botulinum toxin. Botulinum toxin is a neurotoxin produced by the bacteria Clostridium botulinum. And though the term toxin sounds incredibly scary, botulinum toxin or Botox, when used medically and in appropriate doses, is incredibly safe and is not toxic. So Botox was first approved for cosmetic use back in 2002. But before that, it was actually used for blepharospasm. So blepharospasm is a condition that kind of makes your eye twitch, and Botox was originally used for blepharospasms, and then it made its way into the cosmetic world. So in 2002, when it was approved for cosmetic use, it was initially approved for kind of the 11s, which are the up and down vertical lines in between your eyebrows, as well as for forehead lines. Now, of course, Botox is used all over the face and neck and other parts of the body, so it has a lot of uses and we're going to discuss all of it in this video. There are actually 7 types of botulinum toxin labeled A through G, but only types A and B are used in medical and cosmetic treatments. The 3 most widely recognized brands fall under botulinum toxin type A, which includes Botox, Dysport, and Xeomin. Botox, also called Ona botulinum toxin A, is the most famous. Dysport is Abo botulinum toxin A, and Xeomin is Inco botulinum toxin A. So these are all very long names for the molecules that are incorporated within these different brands, but all of these molecules are very similar in action. Only certain characteristics like their molecular size or shape or weight may differ amongst these different types of botulinum toxin molecules. But at the end, their actions are very similar. But because of these slight variations of the molecular structure of the various types of Botox, some patients may find that one type works better for them than the other. The other brand, which is called Jeuveau, it is a relatively newer brand of Botox and it includes the molecule prabotulinum toxin or prabotulinum toxin. And the newest one is called Daxxify, which includes daxibotulinum A. So when I talk about Botox in this video, it will refer to all forms of botulinum toxins and all of these different brands unless I specify otherwise. Which type of Botox have you tried? Let me know by commenting below, and what was your experience with the particular brand of Botox you tried. Now, how does Botox work? Botox temporarily blocks muscle contractions or paralyzes the muscle by blocking the release of a molecule called acetylcholine. Acetylcholine is a neurotransmitter or a molecule that when it's released, it causes the muscles to contract. So when we block the release of acetylcholine, we can help to relax the muscle by preventing its contraction. By doing so, it reduces the appearance of wrinkles caused by muscle movement, such as smiling causing crow's feet, or frowning causing the 11s, or elevating your, raising your eyebrows causing those forehead horizontal lines. So over time, Botox can help to soften all of these different lines caused by muscle expression. It does not help with static lines. So for example, some patients have what's called accordion lines on the cheeks, and these are a type of smile lines, but they're not exactly caused by muscle contraction. They are caused by a loss of collagen and elastin. So Botox doesn't technically help those lines. Botox also doesn't fill. As I mentioned in my filler video, filler fills. Botox relaxes. Botox is not the same as filler. We cannot fill with Botox. Any effects from Botox are also temporary and they usually last about 3 to 6 months depending on the type of Botox used. The other factors that determine the length of Botox include not only the product used, but the dose used, patient's own metabolism. So patients who are incredibly active are going to metabolize their Botox and their filler faster than somebody who is less active. For patients that have those deep-seated 11s in the glabella, so these are caused by contraction of the muscle called the corrugator muscle. So for patients who have this deep-seated 11s or deep-seated horizontal lines on their forehead, it's going to take multiple treatments of Botox to help eliminate or completely soften those lines. And these treatments are spaced every 3 to 6 months. The analogy I give is the following. Let's say that you have a piece of paper And this piece of paper is your skin. I keep on folding it over and over again. This is the action of muscles on the skin. Repeated contraction of the muscle is going to cause those deep-seated wrinkles of the skin. So that's the crease in the paper. So eventually, when I open the paper, you have this crease, which is like your forehead line or your wrinkle. Now, let's say I start softening the crease in the middle. I just start softening this crease, and this is like the Botox, decreasing the contractions on the muscle. Now, if I just soften the crease once, which is like one treatment of Botox, the crease in the paper softens, but it doesn't completely go away. If I kept on softening it, which would be like repeated treatments of Botox, eventually you can imagine that the crease in the paper would go away, just like the crease in your skin. That is the analogy I like to give for why repeated treatments of Botox are needed, because we need to soften the muscle over a prolonged period of time to help get rid of that indented crease in the skin. Once a Botox is injected, it takes about 1 to 2 weeks for it to kick in. And then I usually do a touch-up at 2 to 3 weeks if needed, meaning if I need to make certain areas more symmetric or if I need to inject more into a certain area, I will do it at 2 to 3 weeks. Once a Botox has kicked in, it takes about 3 to 6 months for it to slowly go away, meaning that the effect on the muscle loosens over time. So it's a gradual decrease in efficacy. It's not like the muscles are paralyzed and stagnant for 3 months and then all of a sudden the muscles are back to normal. No, it loses, the Botox goes away over a slow period of time. The newest Botox, which is called Daxxify, claims to last about 6 months. Jeuveau also claimed to last about 4 to 6 months, but we now know that it lasts about 3 to 4 months. By the way, if you are enjoying this video and you're learning a lot, please hit the like button and subscribe to my channel so that you can stay up to date with the latest and greatest in skincare trends and cosmetics. And please share this video to others because Botox is very common. There's a lot of questions, so please share this video with others if you think that they'll also find it helpful. How to decide which type of Botox to get? Well, if you've never done Botox before, then make sure you see a board-certified dermatologist or plastic surgeon so that they can give you their recommendation. I, in my office, usually start with Botox or Dysport first. I see how the patient tolerates it, and I will change to a different one if needed. The reason I would change brands is if the initial product didn't last long enough or if patients had some other weird issues that I might, want to fix with a different kind of Botox brand. When we say, a product lasts 3 to 6 months, that's not like you stay frozen for 3 months or 6 months. It just means that the efficacy of the injected products takes a lot longer to go away. So the product we choose is dependent on your lifestyle, where we want to inject it, and your budget. Some products of Botox are cheaper than others. When should you start Botox? This answer to this question is highly individualized. There is no right age to start Botox, and there is no right age to stop Botox. It honestly depends on your skin, the degree of wrinkles that you have, and your personal goals. Some people may start in their early 20s or 30s as a preventive measure, and some people will wait until the wrinkles are full-blown indented into the skin. I personally recommend that you start Botox if you have the time and money. You start Botox when you first noticed early signs of wrinkle formation. So when you first notice that you are getting crow's feet or you're getting forehead lines. I don't mind if somebody wants to come in to do preventive Botox. I mean, that's kind of what I do to myself. I don't really have static lines or crow's feet or anything, but I've been doing preventive Botox since I was 28. I don't mind if you want to do that. It really, like I said, the treatment is incredibly individualized to the patient. Most of my patients tend to come in when they first notice signs of wrinkles. And this kind of segues into, well, what about preventive Botox? Is preventive Botox really necessary? My answer to this is sure. If you have the time and money, you can do preventive Botox because we do have some research that suggests that when we do adequate dose of Botox, so not overdosing, but adequate doses of Botox or even micro doses of Botox over a prolonged period of time, the person definitely looks a lot better 10 years down the road than the person who doesn't get any Botox done. So if you want to do preventive Botox, awesome. If you want to wait, that's also fine. There is no judgment. As long as your face looks natural and balanced, no judgment from me. Do men get Botox? Men are definitely starting to do more and more cosmetics because they want to look as good as the woman in their life. And so I see a lot of men in my practice, they have stronger muscles. And so we usually have to do more units of Botox. And I tend to see them a little bit more often for touch-up. The reason is, the forehead, for example, is one of the hardest places to perform Botox. And that's because the forehead muscle is what elevates the eyebrows. When you have strong forehead muscles, that means you're using your forehead even more to raise your eyebrows. And if I completely paralyze it all at once, your brows are going to feel very heavy. And so I tend to inject forehead in stages in men. So that means I'll see you, let's say on day 1, I'll inject a certain number of units of Botox in your forehead, and then I'll see you 2 to 3 weeks later and inject more if needed so that you don't feel that heaviness on your brows. Now, I do, Botox in my husband here, and you can see his lovely before and after. He was handsome before, handsome after, but in the after photo, he definitely looks more youthful and more refreshed. He's also had laser done, and he now thankfully wears sunscreen. So all of that definitely helps. So Botox is just one of the tools we have in our arsenal to help fight the signs of aging. Let's now talk about some common misconceptions about Botox. The first misconception is that Botox injections will make you look frozen or unnatural or fake. This is simply not true if done by the right person. It's again the same principle as filler. It's not the filler that's the problem, it's the injector. If the correct dose is injected, then you can have softening of your muscles and still be able to keep your movement. And as you can see, I'm talking to you, I have muscles of facial expression. My muscles were always a little weak anyway, but I can move my muscles the way I have always moved them, but without causing wrinkles. This is why I really stress, do not sell your one and only face to Groupon. Really be mindful of the injector you choose for Botox, for fillers, for lasers, for really any cosmetic procedure. You really want to see the right person. As mentioned in my prior filler video, any medical professional like an MD, DO, RN, PA, dentist, an esthetician with a medical license can just do a weekend course to then start offering Botox in their, practice location. But a weekend course is just not enough time to be able to learn the complex anatomy of muscles and blood vessels and everything that you need to know to be able to inject properly and to correct properly. So please understand that Botox, fillers, these are medical procedures that should be done by a medical professional who really understands anatomy and has taken years of their life to learn about it. The second misconception is that Botox will make you look over full. Like I said before, Botox is not a filler. It's not going to volumize your face. Filler is a filler and it fills. So I have 3 videos on fillers of different types that you can learn all about and understand when we use Botox and when do we use fillers. The third misconception is that Botox is a toxin and it's toxic. As I mentioned before, yes, it is a synthetic protein. Botox is a synthetic protein that is derived from Clostridium botulinum. However, Botox has been safely used since the 1980s for blepharospasms and now for cosmetic procedures. When we use it in adequate doses and we inject it into the muscles, it doesn't really migrate outside of the muscle in the area to then cause systemic issues. The fourth misconception is that if you stop doing Botox, your wrinkles will get worse. This is not true. You don't get rebound wrinkle formation if you stop doing Botox. If anything, the effects of Botox are they last for a while. So even if you stop doing Botox, you still haven't been moving your muscles for however many months, and so you still have an advantage over not getting Botox done at all. And the fifth misconception is that if you continue doing Botox, you're going to age worse and lose muscle tone. This is also not true. Again, it boils down to using the correct dose of Botox per patient's face. So if the correct dose is used every time, studies show that patients will actually look better and will age better compared to their counterparts who don't get any Botox done. The reason you saw this flat forehead and the heavy brows in Nicole Kidman when she was doing Botox a lot is because too much Botox was done in her forehead, which then caused muscle atrophy. As long as we inject Botox in the right amount, you shouldn't get this appearance. Like for me, when I'm injecting your Botox, as you can see this before and after, I still want you to be able to move your muscles, but just to move them without lines. Where all can Botox be injected in the face and neck? First of all, we have to know that muscles of facial expression, they're all connected to one another. This is different than muscles on other parts of your body. Muscles on other parts of your body, they start from bone and they connect onto the bone. Muscles of facial expression, they connect into a layer called the SMAS, which is a little bit underneath your skin. So all of your muscles of facial expression, they move together. So if somebody comes in and they want to treat the lines in between their eyebrows, yes, I want to inject the area called the glabella, but I also want to inject their forehead because I don't want things to move discordantly. So Botox can be injected almost everywhere. So starting with top down, We can inject Botox in the forehead to help with the horizontal forehead lines. We can inject Botox in what's called the glabella, and this helps not only with the horizontal ridge that patients can get, as well as the 11s. We can inject into the eyebrows for a nice eyebrow lift, inject along the crow's feet to help with the smile lines caused by squinting too hard. We can inject into the bunny line. Some people have very prominent little diagonal lines on the nose called the bunny lines. We can help a gummy smile by injecting into a muscle here that pulls up on the lip. So if we inject here, it helps with the gummy smile. We can do what's called a lip flip, meaning if we do a few injection points around the lips, it can cause the lips to evert. So I'm not the best candidate for a lip flip, but it kind of makes that inside of the lip come out a little bit. So it makes your lips look fuller without volumizing or without needing a filler. Often we inject into the muscle called the DAOs. The DAOs are along the angles or the corners of your mouth, pulling the corners down and giving you that frown. So when we inject here, it kind of helps to lift the frown, makes the frown go upside down. It gives you less of that resting bitch face. We can inject Botox into the chin. It helps with dimpling. Botox kind of along the lateral jawline, because this is where our platysma muscle inserts, kind of right here. So if we inject a few units here, it can help decrease a pull on the lower face, thus defining the jawline a little bit more. When I make this really ugly face, you can see those bands. So we can inject Botox into those platysmal bands to help decrease it. There are just a lot of places where we can inject Botox, and it's really one of my favorite treatments because we can use it in conjunction with other treatments like fillers to really give the best outcomes. For some patients that have really thick masseter muscles, which are the muscles that help chew, we can inject Botox there to help slim down the face. This also helps with the problem called TMJ, which is when you clench the jaw really hard and it causes pain. So long story short, we can do a lot with Botox. What are the other uses of Botox besides just paralyzing muscles? Another common use of Botox is using it in the treatment for hyperhidrosis. Hyperhidrosis means excessive sweating, and this usually is a very embarrassing condition for patients, unfortunately, because they get excessive sweating of their palms, their soles, their armpits, sometimes their upper lip. It kind of interferes with their ability to possibly do their job or to give talks. And so we can inject Botox into those areas to help minimize sweating. It doesn't make you dry, but it just kind of normalizes your sweat glands. Botox is also used for migraines or tension headaches. Usually if you see a neurologist, they'll inject Botox kind of in your forehead, in your scalp, kind of a little bit in your neck to help with headaches. Similarly, it can be used for neck spasms as well, because we can inject it into the tense muscle. I even inject the muscle called the trapezius muscle. So we have a long muscle here, or a big broad muscle here called, which are our traps. And sometimes we hold so much tension in our traps. Like I hold a lot of tension in my traps, and this causes neck spasms and pulling on the neck. So if we can loosen the muscle with Botox, it really helps to relieve tension in the shoulders and the neck. I even use it for patients who have Bell's palsy. Bell's palsy is a neurologic condition where one half of the face is not as mobile and the other half of the face is hypermobile. So we'll inject Botox into the hypermobile side to help decrease some of the spasms that patients with Bell's palsy have. And this is similar to Botox original use, which was a blepharospasm, where it was used for eye twitching. You can now dilute Botox and use it to help shrink pores. So this is done in a treatment, usually with microneedling. They'll take dilute Botox, dilute filler, put it in with microneedling to help reduce and shrink pores. I even use dilute Botox to help with rosacea because it can constrict the blood vessels, which cause flushing and redness. So lots of uses for Botox, not only just in the cosmetic space, but also in the medical space. If you have a Botox appointment, how should you prepare for your Botox appointment? So first, you should avoid blood thinners, because anytime we do injections, there's a risk of bruising. So if you can avoid medications like over-the-counter medications that thin your blood, like ibuprofen or aspirin. Also avoid certain vitamins like vitamin C, ginkgo, garlic, fish oil supplements. All of these can thin your blood. So if you can reduce their intake or just stop these kinds of vitamins for 2 weeks prior to the procedure, it's going to help a lot with bruising. And even alcohol and cannabis products can thin your blood, so I usually recommend avoiding them for about a week prior to your appointment. What are the common side effects of Botox? So the first time patients get Botox done, they sometimes get a headache, and that's because we inject the Botox into the forehead and they've never had forehead injections before. And what it does is that it can irritate the layer called the periosteum, which is a covering on top of the bone. This periosteum has certain nerve endings, and when Botox is injected and kind of irritates it, it can cause a headache. So I usually recommend that patients take Tylenol or ibuprofen after their first Botox injection. But usually subsequent injections don't really give headaches. So it's kind of weird that the first one does, but not the subsequent ones. Like I said before, with any injection, you can get bruising. So that's one of the other common side effects, especially bruising around the crow's feet because that skin is so thin. Arnica, which is over the counter, can help with bruising, and even eating a ton of pineapple can help with bruising because pineapple contains an enzyme called bromelain. But you have to eat like a lot of pineapple for it to help. And remember that it takes 1 to 2 weeks for the Botox to kick in. So initially, while it is kicking in, your muscle movements are going to be asymmetric. What not to do after your Botox treatment. You cannot lay down for 4 hours. You cannot exercise for 12 hours. I don't want you to massage any of the lumps or mosquito bites where the Botox was injected. You know, they look like mosquito bites where we inject it, but those go away after a few hours. You know, it doesn't matter if you move your muscles or not move your muscles. The Botox is going to go where we want it to go. So I just want you to leave your face alone until the evening. What are the major risks and downsides of Botox? So the main risk with the Botox molecule is that it can migrate to a nearby muscle, causing an undesired effect. So usually this means that, let's say we're injecting Botox into the glabella, well, it can migrate into a muscle called the levator palpebral muscle. The muscle, when it contracts, open the eyes. So if the Botox migrates to that muscle, you can get what's called eyelid ptosis or eyelid drooping. And this phenomenon gained a lot of visibility because there was a TikToker who got eyelid ptosis and was very vocal about it. If this happens, we give eye drops called aproclonidine eye drops, and this contracts what's called the Mueller's muscle, which is also part of your upper eyelid. And when we contract the Mueller's muscle with the eye drops, it elevates the eyelid by about 1 to 2 millimeters. We can also inject Botox on the contralateral side, meaning on the opposite side, to help kind of even out the eyebrows if needed or the eyelids if needed. And then just remember that Botox goes away within a few months, and so any side effect that you have would also go away within a few months. Eyelid ptosis usually happens to injectors who are not as well trained or who are in their, who are learning. Usually this risk goes down with more years of Botox injections or with adequate training in anatomy. The other risk, similar to eyelid ptosis, is eyebrow ptosis, meaning that if we inject Botox a little too low in the forehead, we're going to droop your eyebrows or make it feel heavy. Sometimes, even if I don't inject Botox very low onto the forehead, because some patients use their forehead to open their eyes and to raise their eyebrows, even if I inject a few units, it can make their eyebrows feel heavy. So that is why for some patients who I see that they're using their forehead a lot to open their eyes and to raise their eyebrows, I will soften the forehead over a period of time versus all at once. There are some patients on social media that have also noted that after Botox injections, their smile has changed. And this is more common when we do masseter injections. So if too many units are placed more, what we call, your masseter muscle is the muscle that when you clench, you can see it. And if the Botox is placed a little bit too anteriorly, then it can migrate to some of the muscles nearby, which help with smiling. So if the Botox goes in the area, it's going to affect your smiling. Similarly, if we're injecting your crow's feet and the Botox migrates a little bit on the lower cheek, it's going to affect your smile. Again, all of these risks are greater with injectors who don't know their anatomy as well or who are not as well trained. But should any of these things happen, it is not life-threatening and the effects wear off. Good and bad effects wear off. A common question that I get is how to make my Botox last longer. Most patients, love their results from Botox, but they hate coming to get it done every 3 to 6 months. And so how do you make your Botox results last longer? One way is to take zinc supplement. So you take zinc 50 milligrams, 1 pill twice a day, starting 4 days before getting Botox and continuing a week after the treatment. You can also take 50 milligrams or 1 pill once daily. Zinc has other benefits as well, like it's helpful for probably acne, it's helpful for boosting your immune system. So there's a lot of benefits to daily zinc supplementation. There are many different types of zinc. So the typical forms of zinc that come as 50 milligrams that get absorbed better by the body include zinc picolinate, zinc glycinate, and zinc gluconate. The original study that looked at zinc with Botox was done in 2012, and they looked at a prescription medication called Zytase, which contained zinc plus an enzyme called phytase, and they found a 30% increase in the longevity of Botox. However, this study design did have some flaws, but since then there have been a few other studies that have corroborated the effects of zinc on prolonging Botox. So I think zinc is beneficial for other things and it's not harmful, so make sure you consult with your doctor before you try it. But I recommend it to my patients who want to make their Botox last longer. The second thing you can do is to use peptides in your skincare. You can check out this video on peptides to learn how to implement peptides in your skincare and how they can prolong the effects of Botox. There are also several lifestyle habits that can either impair or prolong the effects of Botox. So for example, smoking can break down collagen and elastin, which can reduce the effectiveness of Botox. Similarly, excessive sun exposure, which also breaks down collagen and elastin, can impair the effects of Botox. So, wear sunscreen and don't smoke. As I briefly mentioned before, Daxxify is a newer Botox that claims to last about 6 months compared to 3 months for the other forms of Botox. This particular Botox, or daxibotulinum A, has a peptide linked to its botulinum molecule, which prolongs the effects of Botox. It was approved back in September of 2022, and it came into our offices in early 2023. So I still haven't seen patients 6 months after treatment to be able to tell you, yes, it lasts 6 months, or no, it doesn't. In clinical trials submitted to the FDA for approval, 80% of people using Daxxify had no or minimal visible wrinkles at 4 months, and roughly 50% of participants still had little or no wrinkles at 6 months. So this is where that 6-month time frame came from. So when it comes to Daxxify, I tell patients that it will save you time but not money, because Daxxify also costs twice as much as normal Botox. So it saves you time but not money. And right now, like I said, I don't know if the claims are 100% accurate, because as of making this video, I haven't had the full 6 months to evaluate patients. So let's look at some befores and afters. This photo is actually me. You can see in the before photo, even though I am smiling in both photos, by the way, but my eyelids are a little bit heavy, my eyebrows are a little droopy. In the after photo, my eyes are more open. I injected my tail of my eyebrows to give myself an eyebrow lift. I also injected a little bit along my crow's feet to help get rid of some of those fine lines, and injected under the eyelid margin, which I tend to do in younger patients because it kind of opens the eyes. This is my husband, who I showed earlier. In his after photo, he looks more vibrant, more handsome, and just a little bit more youthful, because some of his crow's feet, his forehead lines, and his 11s are a lot softer. This is a dynamic video. You can see that when she's making her expressions, you can really see those lines, and even those 11s are present at rest. But in the after video, she doesn't have any of these wrinkles, but the movement is still maintained. And this is important. We want to maintain the movement. In this before and after, which I have shown before in my filler video, in the first session, we did Botox along with some fillers, and then the second session focused more on fillers. So you can see that with the combination of Botox and fillers, we restored the upward vector of the face, meaning that we made the square-shaped face into a more upward triangular face. But I also used Botox to help soften the lines in between her eyebrows, the forehead lines. I gave her an eyebrow lift, which giving her that eyebrow lift actually opened up her eyes. So she has kind of hooding in the before photo, and Botox helped with the hooding in the after photo. So in the after photo, you can see that she still looks like herself, even though we did change her face shape a little bit to make it more feminine, but it doesn't look like anything was done. So make sure you share this video with anyone who may find it helpful, and don't forget to subscribe to my channel so you can learn all about cosmetic and skincare trends to help you stay youthful. Remember that aging is a multifactorial process, and that's why we have to use multiple tools in our arsenal to address the aging process. So do not be afraid of Botox. Do not be afraid of fillers. Do I think that sometimes we place too much emphasis on Botox and fillers? Yes, but only because they are overdone, and I blame the overdone part on social media and lack of regulation on who can inject. If Botox and fillers are done nicely, it can really restore harmony, balance, and youthfulness to the face in a very natural way. So check out these 2 videos that dive deep into the world of hyaluronic acid and biostimulatory fillers. Subscribe to my channel, and thank you so much for watching this video, and I'll see you in the next one.